There is a shortage of registered nurses in hospitals and doctors' offices. Today I want to persuade you that the shortage of registered nurses is dangerous to patients, even though hospitals continue to operate as though all is well. A student RN told me about how in the classes they tell the students that they're supposed to take care of the patient's emotional well-being as well as the physical things, but that due to the shortage, some things have to be left to chance. You take care of what's medically necessary and let the other pieces of the puzzle go left undone. And I recently had surgery on Thursday and found myself to be in a sort of a cattle room with 20 other people waiting to go into surgery, and one RN running from person to person, putting in IVs and running to the next person, doing the very best she could and doing a wonderful job of it. But she was clearly overstressed and needed some help. So that's what made me think of this topic. I'm going to prove to you that the shortage is real, and then I will prove that patient care is affected by this shortage, and that hospitals compensate for the lack of RNs by using less skilled staff. And that's not to discount the LPNs or CNAs and their abilities. It's just to say that RNs have a different level of skill that is needed. They have knowledge that isn't provided to LPNs and CNAs, a lot more depth of knowledge. So without those RNs, you lose a great skill. You can sometimes use the lesser skilled folks to pick up the slack and the emotional in that kind of way, but there's definitely a critical shortage. So thank you very much, and I look forward to our speeches.